Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Devina Wadhwa. She's a psychiatrist in Canada. Today's Kevin MD article is How Abuse in Healthcare is Driving Doctors Out of Medicine. Devina, welcome back to the show.
Thank you. Thank you very much.
All right, tell us what your latest article is about.
So my latest article was inspired by a tough day at the hospital or at the office, and I just started to reflect on what clinicians face nowadays. And it stemmed from personal experience of having a day where I faced a lot of verbal abuse and racial abuse, and I think I just felt extremely overwhelmed and disempowered, and I started to look at what's out there in terms of clinicians reporting and describing suffering from abuse on the job. And I was shocked as to how pervasive abuse, and I sometimes feel like it's a very strong word, but at the same time, I think it is the correct word. Clinicians are facing various types of abuse on the job, and it feels like the prevalence has increased significantly since I begun training, and I feel like it's spiraled even more so after the COVID pandemic. So this article really talks about this lens of it's not okay to be abused on the job. It's not okay, if you walk into a bank to, have the teller get yelled at. So it should be exactly the same when people are seeking care in hospital settings or in clinic settings for that matter, to be able to treat each other with respect. And I think that's feeling like it's degrading. And a lot of it has to do potentially with frustrations that patients face on the front lines in the emergency rooms, waiting for hours and hours and hours. And by the time you do see your patient and do try your best to provide the best care, I think they likely have escalated to a point where I think you're on that brunt receiving end of abuse. And I speak from a physician lens, but I do think, my nursing colleagues describe the same sort of traumas that they experience on the job. So that was the inspiration for the article in terms of vocalizing my experience and sort of connecting with other clinicians that have felt this way. And the thing that I always get sort of stuck at is how do we make positive change? And for me, writing and putting the opinion out there is one of the ways to bring awareness, and talking to you on this podcast is another way for me. So that's sort of what inspired this article.
So we're reading all the time about those escalating numbers of both verbal and physical abuse against everyone in healthcare, those on the front lines, clinicians, nurses, and it's becoming a dangerous place out there for us to practice. In your case, tell us a little bit about your situation, where this abuse occurred, as much as you could tell us.
Absolutely. Keeping obviously every aspect of the patient story confidential. As a acute care psychiatrist, again, servicing the emergency room is one of the things I do frequently. I had a very angry patient who, was coming into hospital seeking respite from being homeless and living in the shelter-based system. And we connected him to social work services. We were able to try and improve his living situation. However, that meant that he was still going to be living in a shelter situation, but just a better shelter, for lack of a better word, pardon me. And he was extremely furious and threatened to kill me. And it got, involvement with police and getting a restraining order. I live in I call it a small to medium sized town. It's a town of about 100,000 people where, you in the community, it's small. And so I finished my day and I had just gone to do some errands, and I checked my mirror of the car to be like, is this individual here? I actually felt scared. It sounds a little bit dramatic, but walking into the store, I was a bit hypervigilant and I felt like this is not okay. And it's not the first incident where I've been threatened by a patient or racially abused. I've suffered quite a bit of racial abuse on the job as well. But this one really affected me where I felt not safe in my life, in the community, feeling like, what if this person is here? What could they potentially do to me? And I thought about this sort of psychological safety and in the importance of feeling psychologically safe in your life. And it struck me that, I didn't. And that was sort of a big aha. And changing jobs isn't the solution. Changing towns isn't the solution. And I don't know what the solution is, but I bet you it happens to a lot of clinicians all the time. And, tying into my last article around burnout, I think things like these and experiences like these also make us feel like, wow, am I really serving? And is there purpose for what I'm doing when it's impacting your life in that way?
So, when this happened to you, tell us the type of support you received from your colleagues and hospital administration.
So I do have to say I work in just a fantastic team of acute care psychiatrists, and the leadership of my team was extremely supportive. We developed a crisis plan where if this person was to represent, I wouldn't be the psychiatrist having to see them, look after them, or be consulted. We were going into a long weekend, and I was covering the entire long weekend, so we safety planned that if this individual did come, what was going to happen with regards to who was going to see him if a psychiatric consultation was requested. The emergency team was also very supportive of saying we'll be able to look after the patient if psychiatric consultation is needed. We'll have the next available psychiatrist see them. So I was actually really impressed by sort of bringing this up to the hospital team. It was very well received, and I was actually very well supported, which is wonderful.
So, after receiving these death threats from this particular patient, now how has that affected your patient interactions going forward? Is this incident in the back of your mind when you talk to other patients?
I have a hypervigilance on the job in general. Through residency training in Toronto, you're always taught to, lead with empathy, but be mindful of your safety because I have unfortunately had the experience of being assaulted on the job physically. So I always carry a sense of hypervigilance on the job in the workplace when I am working. I think the difference for this one was my feelings outside of being on the job in terms of that hypervigilance, in the community, for example, and these silly thoughts like, what if this individual knows where I live? And I call them silly because, am I overreacting? Maybe, but is this me trying to justify, my emotional state? I don't know. There's some chewing to do there, but and yet I'm hypervigilant.
So tell us what you would like to see in terms of better supporting clinicians or what more needs to be done to support frontline healthcare workers after they receive abuse or even preventing abuse in the first place. What more needs to be done?
I love that question, and that's sort of where I'm chewing. I don't know if your viewers may be aware of the incident in Halifax around safety, and there's some emergency rooms now are considering sort of people walking through metal detectors,
Mhm.
right? And is that an extremist movement towards keeping emergency rooms safe? I don't know because the incidences of aggression have gone up significantly. I think at the heart of it, it comes down to policy change, in terms of, for example, the College of Physicians. Is there really a policy? And to be transparent, I haven't dug in around, can physicians say, I don't feel safe and I can't see this patient? And how do you navigate that? I did call the CMPA, our Canadian Medical Protective Association, around, what are my rights as a clinician if this patient were to represent, and, hospital policy, health policy in general around how can clinicians feel safe to say, I don't feel safe, and, how do we navigate not feeling safe and patient care? Because again, we did this job to help people. And at the same time, if you're not feeling safe, how can you say no to helping, right?
Mhm.
It's complicated. But I think we always talk about policy change at the bigger level, and on the smaller level, frontline individuals like myself, I feel like bringing awareness to these issues and not feeling ashamed talking about them openly, because I bet you I'm not the only one that feels this way. And I have to be transparent. I was a bit I'm going to use the word shy. I'm not shy, but I was a bit shy to come up on the podcast today and talk about this because it feels there's a vulnerability to, talking about not feeling safe and not feeling strong enough and feeling psychologically vulnerable in my community. So I'm sharing that because I think there's people out there that probably and maybe feel the same way.
I completely agree with you. I think that there is a culture of silence when it comes to assault and abuse against healthcare workers. In the United States, there are stories where healthcare administrators they often don't like to publicize cases like this because obviously if they feel that their institution isn't a safe institution where their clinicians are being attacked, that's really not the best image for those hospitals. So there's actually a culture of suppression when it comes to speaking out about these abuses. So with that in mind, and you mentioned the word shame, being a little bit shy sharing the story, but talk about how important it is for the rest of us who are listening to you to know that these things are happening. How tell us why that's so important.
Because I don't think I'm alone, and I don't think we should suffer in silence. And the biggest transformation comes from this sort of community of togetherness. The more voices that speak up about it, the more tangible the change can be. And when I was writing this article, I did sort of try and look at what's the evidence, what's the data. There's not much out there in
Mhm.
terms of individual stories, and sort of individual stories become a collective. And I think that's why it's so important to share this story, because I'm hoping more people are able to share their experiences so that we can say, hey, something needs to be done. As healthcare workers, physicians, nurses, we need to feel safe to be able to do the job and do it well. And that's why I feel so strongly about sharing it, so that our voices can be a collective. Because in society, healthcare workers are really important, right? We need healthcare workers, and we need us to be safe and physically and psychologically well to be able to do a good job. And I think society needs to understand and appreciate that.
Anecdotally, do you personally know or have you heard through your network about other of your colleagues who have been verbally assaulted or abused, or even nurses and other people across the healthcare spectrum who have received abuse? Just tell us anecdotally some of those stories.
I can just tell you, thinking about the amazing team I work in, and we're also supported by locum psychiatrists that travel up to come help us. Every single clinician has experienced abuse.
Every
Um,
single one. Wow.
Every single one, right? From statements of, and I'll be transparent, and if get me a white doctor, for
Hmm.
example, to are there not any white psychiatrists practicing in the city anymore, to being charged at because people are upset. And I do want to say, people suffering from acute mental illness that are in crisis can sometimes be really distressed, really upset. And I think in psychiatry, there is a level of, I'm going to comfort, let's use that word, with knowing that if somebody is experiencing a psychosis and is feeling really paranoid, they may not feel safe with you, and they may try and, either run towards you because they're not safe, or run away from you. It's almost this acceptance that yes, people with acute psychosis or severe manias may have this level of unpredictability, but you plan for that. I think it's the patients that are very, measured and deliberately threaten or emotionally hurt you, that really get to you. And so every single clinician that I know has experienced abuse, from horrific verbal profane language to physical assault as well.
Now, you mentioned earlier that you had a level of personal hypervigilance, and you obviously talk about how wonderful your team is in supporting each other. But not all clinicians have the traits that you have, and not all clinicians have that team. Now, for those who are listening to you today and maybe the recipient of verbal and physical abuse for the first time, what are some tips that you could give them? What are some pieces of advice you could give them to help them get through that traumatic incident?
Talk about it. I
Hmm.
think we can be very siloed in practice sometimes. I find new grads, it's such an isolating time where you feel like I've graduated, I should know what to do. And I think what's always helped me in life and will continue to help me is having amazing mentors.
Hmm.
After this, I have a wonderful mentor that I always turn to, and I called him and I said, "Can I just talk? I'm feeling really overwhelmed and scared." So I think talking about it and being mindful that medicine is not always safe. So you don't have to become hypervigilant. I don't think that's a good state to be in, but being mindful about your safety. If you're saying, "I'm sorry, I can't prescribe you opiates," really being mindful. Are you alone in a room listening to your gut? The number of times I've ignored my gut, that's the times when bad things have happened, right? So your body tells you, gives you messages. So I think talk about it, share your story, find safe places to share your story, watch your body, listen to your gut, and just be mindful that medicine is wonderful. It's not always safe in terms of, bad things can happen to us as clinicians. And sometimes the patients we're trying to look after are the ones that can subject us to abuse.
We're talking to Devina Wadhwa. She's a psychiatrist, and today's Kevin MD article is How Abuse in Healthcare is Driving Doctors Out of Medicine. Davina, let's end with some take home messages that you want to leave with the Kevin MD audience.
Thank you. As mentioned, use your voice, as our voices are powerful. And when we create a collective, I think change happens. Access mentorship when you are struggling with abuse. It's not normal to be abused on the job. It's not okay to be abused on the job. Talk about it. Seek help if you're feeling scared, vulnerable, anxious, because again, it is a normative reaction to being abused on the job. So thank you. Those are kind of what I'd like to leave your audience with.
Davina, thank you so much for sharing your story time and insight, and thanks again for coming back on the show.
Thank you. Thank you very much.